I'm James Burruano, podiatrist and chief medical administrator at Neighborhood Health Center. Welcome to Neighborhood. I was in practice for about 24 years on my own, independent, in 2 areas in Buffalo, and I enjoyed that very much. But when Neighborhood Health Center took over Kaleida in the Matina facility down on Niagara Street, they asked me if I wanted to work full-time for them. And initially I said, no, why would I do that? And then 6 months later, I decided that was a fit for me because I could impact more people. Neighborhood Health Center had a lot of primary care patients, and that way I was able to really get involved in not only patients' care, but also the community and then other wraparound services that Neighborhood Health Center offers that would help my patients even farther than I could have helped them in private practice. So it was a real win-win situation for me, and that's why I decided to come to Neighborhood Health Center. One of the patients that I can recall wasn't really that long ago, but it really had nothing to do with podiatry. It was more, I walked in the room and I noticed the patient was anxious and nervous, and I just asked the patient, "Are you okay and what's wrong?" And the patient opened up to me, and I was able to allow him to just chat and talk and tell me how he felt. And then I went and got our behavioral health counselors, which are right in the building, and he had consented to do that. And actually the patient came in about maybe 4 or 6 weeks afterward and thanked me for starting that process where he could have someone to talk to and be counseled and go through some of the grief he was suffering. So that really was very impactful to me. Because you work here, you're able to tap into all the services that are available for our patients. And then it doesn't encumber you as a provider to have to figure all that out. I can see patients, come up with their diagnosis, and then rely on my team to make sure they understand what that is, such as the language line or language barrier. They have transportation to get there, and somebody is navigating the whole process for them so that I can move on to the next patient knowing, in my brain and in my heart, something's being done and my patient is going to be okay. I mean, if you think of, okay, for me, for example, if I'm in Italy, I can't speak the language, I don't know where to go, and if they don't help me get someplace, I would be done. I wouldn't be able to, I would just say the heck with it. Throw in the towel, just give me some pills, and I wouldn't be my own advocate for my own health care because I don't know what to do. All the things that would encumber a patient from getting the care they need, it pretty much breaks down those barriers here, and you got ancillary help though, so you're not doing it all on your own and not worrying about it. So that's what I like.